it is also important to know which suture to use. So suture number is where we need to use the stitch, make what suture we need to use. So when you're doing any intraoral stitches, 3/0 vicryl repeat is usually the most commonly used stitch. So this is 3/0 vicryl repeat. In the beginning, it make it very easy just to stick with 9974, which is 3/0 vicryl repeat round body needle. This is all fine to use buccal mucosa, tongue. But if you're on a lip, we know the lip tissue, we want to use something fine. So I would suggest using 4/0 vicryl repeat. So when you're using lower lip mucosa, then it should be 4/0 vicryl repeat. Come to skin. For elderly population, it should be okay to use not very fine stitch. So you should be okay to use 4/0 if it's forehead lacerations, but or even on cheeks for an elderly person. But if you're stitching kids, young population, finer the stitch, the better the scar tissue and better the healing. So at that time, you'll be using finer stitch. So you will be reading here, it will be 5/0 or 6/0 vicryl repeat. That is for skin. But if it's a tissue with a deep laceration, deep wound, you will need some security for underlying muscle. So for underlying muscle, you use 3/0 vicryl repeat or 4/0 vicryl repeat. But for skin, it should be 5/0 or 6/0 vicryl repeat for young population. For kids, almost always it will be 6/0 vicryl repeat. The third thing you will need to be aware of is whether it's dyed or undyed. Dyed stitch will be purple, undyed will be white. It is very important never to use the dyed stitch, which is a purple stitch on the skin, because it can leave tattooing behind. So make sure on a skin you never use a purple color skin, which is a dyed stitch. So when you see this purple on a packet, that is a violet skin stitch. That stitch is only for intraoral purposes or very occasionally some deep tissues, because that takes some time to absorb. But make sure on skin you never use your purple, violet, vicryl stitch. So skin, it always needs to be white, which is undyed. It can be vicryl repeat, which is 7 to 10 days to absorb. It could be vicryl coated, but make sure that is white in color.